So we talked about the fact that there's been this bar, this prohibition on using federal funds to cover immigrant children, legal immigrant children that were included in the 1996 welfare reform changes. And because of that bar, there were quite a few states, and I think it's about 18, that stepped in and decided to cover those kids with their state dollar. And here you see the list of those states. And then perhaps even more heroically, certainly more heroically, we had a smaller number of states that actually either have been or recently started covering children regardless of status, so including undocumented children. And there are a few states like New York and Massachusetts that have been doing this for a long time, in D.C. There's two states, Washington and Illinois really was the leader, and the former governor, who clearly has his issues, and he's probably going to be on the Jerry Springer show next, but he really did step out on this issue, and when he said he was going to cover all children, he meant all children. So here in Illinois, all children, regardless of status, are eligible for coverage, and they've really made progress in trying to reach their uninsured kids. Washington State had also passed an expansion that was to all children, and it wasn't until recently that actually the funding went through, and there were other federal barriers that the Bush administration had put up, and those have been taken away. So they too are moving forward. So that's exciting. California is, probably those of you from California know here, there's some counties that are covering all children, but it's not a statewide initiative. So this I kind of tossed in. This is actually from a report that came out from the Pew Center the day I was making the slides. And what it was looking at was the growth in the number of children who have at least one parent who is undocumented or unauthorized, as they call them. And what you can see from this slide is that there's a growing number of children who are citizen children, who are in mixed status families. And of course, there are mixed status families of all types. It wouldn't have to be somebody who's undocumented. It could be a legal immigrant. But I think this is really instructive because we talk a lot in the world where I live, which is kind of the children's health coverage world, about the fact that there's a lot of interest and initiative in trying to enroll all eligible children, because about 2/3 of uninsured children are actually eligible for public programs. So we could really, if we could get all those kids enrolled, I mean, we could sharply reduce, even leaving aside healthcare reform, we could really, really get our number of uninsured kids in this country down very considerably. But you have a lot of these kids who are living in these mixed status families who are fearful, who may not know they're eligible. And so to the extent that we're focusing on outreach and enrollment efforts, we need to really be aware of this growing trend and incorporate that into our thinking and our policy making and our work at the community level and reaching out to these families. So let's turn now to the part of the talk that talks about what's been happening in Washington since January 20th, because it's a really exciting place to be right now. So as I mentioned before, the CHIPRA bill, which was the reauthorization of the CHIP program, had been hanging around. It had been a source of a lot of contention in the last Congress, where the president had vetoed it twice. And President Obama had said that this was going to be one of his first acts when he became president, and indeed it was. It was the second bill that he signed, and on February 4th. And when he signed it at that time, he described it as a down payment on health care reform and kind of a first step in the health care reform process. But just to give you a kind of quick summary of what was in the bill, as I mentioned before, there's quite a fair amount of new money in the bill. There's new funding levels for states. But in order for states to be able to maximize their federal funding, they need to step up to the plate and use it. There were some weird quirks in the past about how the funds were allocated, and that has all changed. So now it's turned really more into a situation of use it or lose it, because if states don't pick up their funds in the first couple of years, they'll start losing some of their funding in the out years. There's also new incentives in the bill to enroll Medicaid children in a couple of different ways, and I won't spend a lot of time on that, but there was a lot of discussion in the debate, and President Bush, one of the reasons that he vetoed this was because he really cared about the lowest income children. And so he was very concerned that we were focusing on these slightly above the lower income children. So he said, despite the fact that actually a lot of the focus in the bill is to have new incentives for states to enroll Medicaid-eligible children, the lowest-income children, through something called a performance bonus, where states will get rewarded if they bump up their Medicaid enrollment. So all of these things, as I say, are in our summaries, so I won't spend a lot of time on them, but they're there. There were some eligibility changes, and the one we're going to talk about today is probably known to many of you as IKEA, and that is the provision that addresses immigrant children's eligibility, so we'll spend some time on that in a minute. And there is a new emphasis in the bill on quality, access to care. There's a new commission looking at provider rates, those kinds of things, to try to start really addressing those issues that, you know, having coverage is not enough. You need to be able to access your coverage and get good quality care. So when President, oh, look at that, his name jumped over. When he signed the bill, and I unfortunately was not there, he had made a commitment, and let me just say that the inclusion of IKEA, which is the option to cover lawfully residing immigrant children, was the most notable difference in the bill from the version that had passed the Republican, when President Bush was president, that had passed the Congress. In both cases, there was a lot of bipartisan support for this bill, but the inclusion of IKEA, which had not been in the previous version, was extremely contentious. And it was very frustrating. I know IKEA was something that I worked on when I was at Families USA. I mean, I've actually given birth to 2 children since I've been working at IKEA. So this has been a long time coming, and the oldest one's going to middle school. So this has been a long time coming. I don't see that it should be such a heavy lift. We're just talking about legal kids here. We're not even getting to undocumented kids. Pregnant women, the children are going to be citizens when they're born and on Medicaid, and so it seems smart to give them prenatal care. But despite that, this has been a hugely heavy lift, and it has been years to get this through. And they're actually, Senator Grassley, who was the key Republican, sponsored the bill in the Senate, was just absolutely livid that IKEA was added to the bill. And it was just super contentious. And I think actually that President Obama was personally committed to this provision. And that really was essential to making sure that it stayed in the bill, that it got in the bill. It wasn't in the bill before, it got added. And the fact that it stayed as it went through all of this contentious negotiation, his leadership was really critical. And here you see a quote from him at the bill signing ceremony. And I think this was one of the first things he said, and the room spontaneously burst into applause when he mentioned immigrant kids. People were just so excited, and those of us who've been working on it a long time were just thrilled that this was added. So what does this new option mean? Well, as of April 1st, which obviously just passed, states have the option to obtain federal matching dollars. So that means that this is not a done deal. Your state's going to have to pick up this option. And that's the way a lot of Medicaid and CHIP works. Mandates, used to happen, but at least since I've been working on Medicaid, we almost never get a mandate anymore. So it's a state option, and they can get federal Medicaid and CHIP matching dollars for covering lawfully residing children and pregnant women, and that's the term in the statute, lawfully residing, regardless of the date of entry, and that's where you get rid of the 5-year waiting period. You can cover them through Medicaid and or CHIP, but you have to start with your lowest income kids. So that's really a protection so that a state wouldn't come in and say, well, I'm going to cover the higher, the working families, and I'm not going to cover the kids below poverty. And so you have to start with Medicaid. So you've got to start from the lowest income eligibility level. You'd have to pick up the Medicaid option, and then you could pick up the CHIP option as well. Now, this I think was not actually recognized when the bill was going through, but one of my colleagues I think astutely pointed out that this is a little bit technical, but you can get the CHIP matching rate, which is a higher matching rate for all the new kids, even if they're in Medicaid. And we've gotten CMS to confirm this. They haven't publicly said this yet, but we have an email from them. So if anybody needs it, let us know. So your state can actually pick up the higher CHIP matching rate for covering these kids, even if they're Medicaid income eligible. So in these tough budget times, that's an important feature. And I won't even go into the reasons why, but we've got it in the email. So.